I want to talk a little bit about former President Biden and what I've said publicly about this. Here are some of the facts that I want to set this up for you in terms of my suitedness to talk about this topic. I have prostate cancer. I've had a prostatectomy radiation, SBRT. 14 years ago was the prostatectomy was probably 12 years ago now. SBRT about 3 or 4 years ago. Doing fine, thank you. But I'm very involved with an organization called the Prostate Cancer Foundation. We fund research on prostate cancer. I listen to scientific lectures on the topic of prostate cancer on a bi-monthly basis. Number 3, I've treated prostate cancer for 40 years. I remember prostate cancer being a sleepy illness that we just would tell people, you'll die of something else, or you're going to die of this thing. Nothing we can do about it. Now, thanks to Michael Milken and the Prostate Cancer Foundation, it is a highly treatable condition. And there is a bit of controversy here, so let me try to parse things out. First, Nicole Saphier, who I respect and love immensely, has gone on the record saying that they would not have done a PSA on a man of President Biden's age, which I disagree with in the strongest terms. It's possible that he and his doctors may have elected not to do it. I doubt it. It's routine care. I know there's a little controversy around it. Of course, I'm well versed in that. But a president of the United States is going to get a yearly PSA. That's just what's going to happen. Then the fact that they said they found a nodule. We found a nodule. And lo and behold, there's metastatic disease. No, that did not happen. We don't really even do the digital rectal exam anymore. We follow the PSAs. What is that there, Caleb, you're putting up? I can't quite read these things sometimes.
Oh, it's a post from Matt Walsh that was talking about the topic about Biden suddenly having cancer, which doesn't make sense. That it just seems like the timing is strange because they waited until days before that big book is coming out.
Right. For sure, the time, but I'm telling you, clinically, it does not work like this. It just doesn't show up like that all of a sudden. It's usually, it can present about 2% of the time, maybe even 4% of the time, it can present it in a more advanced state. But usually it's an aggressive tumor that kind of gets away from you over the course of a year or 2 years or 5 or 7 years. Hard to predict. He has a grade 9 of a Gleason scale. I had a grade 6, which is a low grade. I actually went on active surveillance. It's possible they put him on active surveillance. There's a lot of possibilities here. The point is they are being extremely obscure and not giving us the details, and none of what they're saying really makes sense. Now, you could ask the question, isn't he entitled to his own confidential health care? I disagree. I think if somebody is getting into the pilot seat of an aircraft and I or other physicians see some degree of impairment or concern about that person's ability to fly the aircraft, not only do we have a right to ask questions, we have an obligation to get on that and figure out what's going on. And I would argue that the President of the United States is the pilot of this entire ship we call the United States. And us not asking questions is unethical, and frankly, the fact that they don't give us information is disgusting. Now, people go, there's always been presidents of hidden scandals. Yes, they have. And those are equally disgusting. Equally disgusting. They're not okay. They've never been okay. The fact that Woodrow Wilson had a stroke and was out of it for 6 months, not okay. The fact that JFK had a psychotic episode on amphetamines, look it up, it happened. Not okay that we didn't know that. Imagine if that was during the missile crisis, for God's sakes. Point is, we need to know about our leaders and what their condition is, and we need to be able to discuss it and talk about it, and physicians need to have opinions about it. My opinion, I'm giving you now. This is my opinion. I'm entitled to it, and it's no longer okay for people to shut up people who have opinions and expertise. You can take the opinion, leave it, do what you will with it. I have an opinion. I will be offering it. So the thing that concerns me is we've seen him decline over the last 2 years rather significantly. And one of the things that happens with metastatic disease, the first line of treatment is something called androgen deprivation therapy. That is where we block the testosterone, essentially. We used to actually castrate men with this, but now we do androgen deprivation therapy, ADT. Side effect of ADT is cognitive slowing, sometimes frank dementia, falls, muscle wasting. If somebody's Parkinsonian, they're more likely to fall. All the things we have seen over the last couple of years could be explained on the basis of androgen deprivation therapy. By the same token, there's a lot of controversy about the auto pen and should he have used it and did he know what was going on? Parkinsonism makes you lose the ability to write your name very often. They would have a perfect defense there. And just by saying, you know what, the president no longer could sign his name, so we had to use the auto pen. He approved every single one of these pardons, say. We don't know what happened. I don't believe he was impaired to the point of, commitment or, that a legal system would find him unable to take care of himself. But clearly he was significantly diminished. And if indeed the androgen deprivation therapy had been initiated, we should know that because it explains the continued decline. So whatever is going on here, there is my opinion. I don't treat the man. I don't know what's going on. I'm trying to read the tea leaves that they give us, but it is rather disgusting that a president does not open the books on their health care. I think that needs to be a standard. I think every president should take a Montreal cognitive inventory. I know President Trump has done that a few years in a row. He should do it publicly. We should see it being done. So that is my opinion. Susan, am I clear enough? Any questions about this?
You're totally clear.
You were.
I just feel like he could have helped educate other men to get.
That is another point. Yes, thank you, Susan. Correct. Which is absolutely the opportunity to say this: that every man over 50 every year should be getting a PSA. If you have a first-degree relative, that should begin at age 40. If one of your first-degree relatives has prostate cancer or certain Norwegian descents, and here's the bigger thing. Joe Biden claims to be a man concerned about the African-American community's well-being. Here's a perfect opportunity to say something very clear to black men. You need to be screened. Black men, when they present, usually have more advanced tumor and more tumor. They are less likely to be screened properly. And I understand there is a fear that somebody's going to take my prostate out. It's going to affect my manhood. Blah, blah, blah. Doesn't happen. That's an old world way of thinking about this. The fact is, African-American men, we were doing a very poor job of adequately screening them so they don't have more advanced disease. Genetically, they're more prone to presenting with more advanced disease. So the screening needs to be as vigorous as it can possibly be so that more advanced grade of tumor doesn't become a more advanced stage of tumor. The grade is the Gleason score. The stage is whether it's localized or spread. Okay? So they didn't do that. And doesn't that speak volumes about what they're really concerned about? Very interesting. Very interesting. All right. We're going to switch gears. Have I said enough, Susan? Susan always was worried about what people were saying about me online. And my position these days is, it is my opinion. I'm entitled to my opinion. I'm do research on this. I am a patient and I've treated it for 30 years. What the hell if I'm not entitled to an opinion in the United States of America? It is really, it's over, everybody. We got to start speaking up.
Right.
3 or 4 years ago, I was saying it's time to be courageous. I was shocked I was having to say that. Now I'm at the next stage, which is speak up, speak loud, have your opinion. Fine, let's debate it. But don't let people push you down for having an opinion, especially when your opinion is based in tons of experience. Give me a break.